everyone. I'm Phil Garrity. Welcome to the Go Virtual Salon. Before we get started, I'm just going to make sure that we have our screens configured here. As you probably noticed, a lot of people who are entering the room are actually named Phil Garrity. There was an issue with the link, so feel free to rename yourselves in Zoom if you can. That would be great. There's going to be some opportunity for question and answer with the panelists towards the end of the hour, and it'd be great to know who you are. With that said, I'm going to hand it over to Dr. Franklin Huang, who's going to start us off with some opening remarks.
Thanks, Phil. And welcome everyone, and good afternoon and good evening. It's great to have you with us today for our GO's first virtual salon. This really unique event where we get to bring our community together and introduce them to our colleagues in Belize and tell you a bit more about our programs. So I'm an assistant professor of medicine at the University of California, San Francisco, and a co-founder of Global Oncology, a nonprofit that I started with my friend and colleague, Dr. Ami Bhatt, a physician scientist and assistant professor at Stanford University. So first of all, I want to welcome you to this event, and thank you so much for taking some time out of your busy schedules to be with us. It means a great deal to us. While 2020 has been a tumultuous year for us all, we at GO have been fortunate to continue our work along with our partners in Belize to advance our mission in bringing the best in cancer care to underserved patients there and worldwide. We're excited to share some of these exciting updates with you all. Supporters new and old, and we hope it will inspire you to get involved, hopefully support this work, if only by raising awareness about this important cause that touches so many of us. Just to give you an orientation for the event, over the next hour, we'll get to hear from frontline workers and collaborators of the GO-Belize program. You'll learn from our panelists about our collective efforts to launch Belize's first public oncology unit, as well as design a novel patient navigation program embedded within that program, whose aim is to ensure patients receive timely, compassionate care. After some intro remarks, we'll have about 25 minutes for our panel discussion, 15 minutes for questions then from the audience, and a few minutes for closing remarks. And we'll plan to hopefully wrap up at the end of the hour. And throughout the event, you're welcome to type questions into the chat to the Zoom host, GO's program director, Phil Garrity. Phil will be facilitating the Q&A session at the end of the hour, when you'll have the opportunity to ask questions directly to any of the panelists yourselves if you'd like. Also, we're recording this event so that we can share it with our supporters and collaborators who are unable to attend today. Before we get started, I want to give some background on Global Oncology and our partnership in Belize, especially for those of you less familiar with our organization. GO was founded in 2013 with the mission to bring the best in cancer care to underserved patients worldwide. Ami Bhatt and I were training as oncology fellows in Boston, and we were looking for ways that we could leverage the energy and expertise of our community and others in our field to improve access to cancer care, education, and research in low and middle income countries. Much of the global health field had historically been focused on infectious diseases, but we knew that that was shifting towards non-communicable diseases. And we knew that cancer kills more people in low and middle income countries than HIV, TB, and malaria combined. And yet, given the scale of the problem, this pressing issue remains sorely underfunded and under-resourced. So despite 85% of the cancer patients in the world living in low and middle income countries, only 5% of cancer-related funding is spent in these regions. So we thought and we believed that we could make a difference to tackle these disparities, which is why and how Global Oncology as an organization and as a community was born. And so over the past 7 years, we've been fortunate to work with volunteers and staff across the world to lead a diverse range of impactful projects and initiatives to further our mission and collaborate across geographic, professional, and academic borders. We've done this, 1, to build capacity of health systems to deliver high quality cancer care, 2, to educate patients, caregivers, and the general public about cancer, and 3, to help mobilize the community of researchers, implementers, and activists in the global cancer community. And we do all of this to help alleviate the growing burden of cancer in low and middle income countries in this work. As far as our background of our Go-Belize partnership, I first met Dr. Ramon Yacab, who you'll have the pleasure of meeting on here today, over 2 years ago, soon after he completed his oncology fellowship training in Mexico and was preparing to return to Belize to essentially establish the country's first public oncology unit at Carl Huesner Memorial Hospital, the national hospital in Belize City. At the beginning, it was just Dr. Yacab, but soon he and his team of nurses and pharmacists were looking for partners who could help shepherd this new program by offering technical assistance. And our community, as part of Global Oncology, was ready and willing to step in. It's worth noting the historic nature of this all. Dr. Yacab was and still is Belize's first and only medical oncologist. And before the launching of the oncology unit at Carl Huesner Memorial Hospital, Belize had a patchwork system of cancer care services in the civil and private sectors, but no public oncology program. So the launching of this unit is a huge leap forward for the country, 40% of whom live below the poverty line. So over the past 2 years, GO has worked collaboratively with our colleagues and partners in Belize to launch and strengthen the program at the National Hospital in 3 key areas. One, to help develop protocols and operating workflows to deliver safe and standardized care. 2, to provide training to ensure clinicians are competent in chemo preparation, administration, and compassionate care of patients. And 3, patient navigation to educate and support patients to complete treatment in a timely manner. Before introducing our panelists, we do have a special message from a strong supporter and partner of Global Oncology and a champion for cancer care in Belize, the First Lady of Belize, Kim Simplis-Barrow.
Greetings. My name is Kim Simplis-Barrow, wife of the Prime Minister of Belize and chair of the Spouses of CARICOM Leaders Action Network. Ever since my own diagnosis from cancer, I've been a vocal champion to improve access to cancer care for my fellow Belizeans. Global Oncology has proved to be an invaluable partner in advancing this mission. Most notably is their technical assistance and programmatic support in the launching of the first ever chemotherapy unit at the country's referral hospital, the Carl Huesner Memorial Hospital. I look forward to furthering our partnership and expanding our efforts to improve our capacity not only to treat cancer, but also to prevent it. I hope you enjoy Global Oncology's virtual Salon event today and learn more about the progress we've made in Belize as well as the work that remains to be done. I trust that it will inspire, challenge, and move you to get involved and support these efforts. Only by working together will we succeed in advancing our collective mission of improving the lives of those living with cancer in my country and around the world. Thank you.
Well, thank you. That was a fantastic message from the First Lady of Belize. So now I'd like to move to our panelists and have them introduce themselves with their names and tell us a little bit about themselves. Today we have 3 of our colleagues from Belize joining us and 2 of our GO volunteers who have worked closely with our team in Belize and our partners. So first I turn to Dr. Ramon Yacab, oncologist at Carl Huesner Memorial Hospital.
Good evening. It's a pleasure to be with you this evening and thank you for the invitation. My name is Ramon Yacab and I'm the medical oncologist for the hospital's public hospital, the Carl Huesner Memorial Hospital.
Nurse Lorna Kelly, oncology nurse at Carl Huesner Memorial Hospital.
Good evening, everybody. My name is Lorna Kelly, registered nurse working in the oncology clinic at KHMH Hospital.
Nurse Margaret Bernard, oncology patient navigator and nurse at Carl Huesner.
Good evening, everyone. It's a pleasure to be here. My name is Nurse Bernard. I'm proud to represent Carl Huesner here working at the oncology clinic. It's nice being here and nice to meet you.
Thank you. Kristen Cummings, a GO volunteer and oncology nurse.
Good evening, everybody. Thank you for having me. My name is Kristen Cummings. I am one of the oncology nurses that volunteer with the GO program. I've been an oncology nurse for over 25 years, and about 20 years of that I've spent at Dana-Farber Cancer Institute in Boston. And it's just been a pleasure working with everyone on the team.
Thanks, Kristen. And Sirkeen Sherry, a GO volunteer and clinical research coordinator.
Hi, everyone. Nice to meet you all virtually. My name is Sirkeen Sherry. I'm a clinical research coordinator with Dana-Farber Cancer Institute in Boston. I've been volunteering with GO for about the past year and a half, working closely with the whole KHMH team, but specifically with Margaret on the doc officer program.
Great, thank you, Sirkeen. Thank you, everyone, for joining us. So why don't we first start with our panel, and I'll turn to Dr. Yacab first. And so I'd like you, if you could tell us a little bit about your upbringing in Belize and how you came to be Belize's first and only medical oncologist.
Gladly share the story. First, I was born in rural Belize, actually, in the border next to Guatemala. So there's actually no formal medical school here at Belize. So most of us who want to further studies have to travel abroad. We have to live elsewhere. In my case, I moved to Guatemala, where I spent actually 7 years studying general medicine. And after that, I came back to Belize, and I was roughly for a year here, and I was seeing. And I got involved a lot in palliative care through the Belize Palliative Care and Hospice Foundation. I noticed that there were so many cancer patients that were suffering. A lot of them weren't really receiving treatment. Most of them were dying from diseases that were progressing because there wasn't service available. This prompted me to continue studying, and then I decided that it was time to do the specialty, and that's when we did the tests, and we migrated to Mexico, where I was actually there for 7 years. The thing is that for most of us Belizeans here, the opportunities when it comes to education in terms of medicine, it's lacking. So most of us have to travel abroad. Now, why oncology? Because I noticed that there was such a need, not only because there was the history in family, which I had first contact with relatives who died from colon cancer, and the only thing we had available for them was morphine, but also knowing that a lot of these conditions are, one, preventable and treatable. So I wanted to make a difference. And by God's grace, I met Franklin, and 2 years, 3 years being back here at Belize, we've been seeing progress, and I really appreciate the great work that Global Oncology has done along with us. It's been a great teamwork here. We've been changing people's lives. I mean, during the first year here at Belize, I was still seeing a lot of patients really felt a little bit hands tied in terms of offering treatment, but thanks to the technical assistance, we've been able to change that. I know we have a lot of challenges still ahead, but through teamwork, through the assistance that we've been getting, and through the assistance by everyone, we've been able to change people's life. And even if it means changing one person's life and seeing that person smile, or even if it may be a small detail, it may be a small things can change the world. And that's the way I'm seeing it here at Belize. Thank you.
Ramon, could you tell us a little bit about the founding of the unit? What have been the biggest challenges you faced in starting and then running the unit itself?
Sure. The first thing is, when I came back to Belize, there wasn't any cancer services. I mean, I came in to the hospital not knowing what I was going to encounter. I thought maybe there was a type of service in place. There was none. So it was practically, it was an uphill battle. We started small with a little clinic, giving consultations, sometimes wherever we could see the patient. Why do I say this? The clinic wasn't, it wasn't only for oncology. I mean, most of us rotate through the clinics. So sometimes I would try and find a little room to see patients at the emergency room or any other service. And as we went along, we started noticing that word was out that there was cancer services, at least evaluation parts at the KHMH. And slowly we started noticing that patients started to come in to look for us. Without appointments, without consultations, some of those patients traveled around 4 hours to come to Belize because they found or they heard that there was a cancer specialist. So we proposed this plan to the hospital and we managed to open a small clinic. And that was during the course of the first year. During that time, we were, Global Oncology was helping us with, we were starting there with the technical assistance. And at the same time, we were trying to raise a proposal to improve services in Belize. And noticing the amount of patients that we're starting to reach, the hospital where we work bought into the proposal and they were very supportive. So after that, what happened? We were using the emergency room. The demand was increasing that most of the times we were joking there with the doctors that it was becoming an oncology hospital. Sometimes half of the emergency room would be there with our patients, either for pain management, some for comfort measures, and others that we were giving a little bit of chemotherapy to them. And as the demand grew, so did the need to improve the services. And hospital was supportive. We managed to retrofit a small unit that we're currently using, and we were actually giving chemotherapy for the first time in the public health system. For me, this is a this is a great milestone. I mean, offering treatment within the public healthcare system, that's a first for us. And it's changing people's lives. I mean, I may have said it in a couple of minutes, but it's been 2 years, 3 years, and certainly we have a lot more to go. And I'm very grateful I'm being very grateful for all the assistance because none of this would have been possible without the assistance from Global Oncology. And it's about all of us have been there, and Nurse Margaret and Nurse Lorna will later on share the challenges that our patients have. I mean, the poverty is a problem here at Belize. Roughly 40% of the population lives in poverty. There are challenges to access cancer treatment, but if we make it available for them in the public health system and ensure that they get treatment and we don't lose them, I think that's an accomplishment for us.
Great. Thank you, Dr. Yacab. As you mentioned the nurses, I would like to turn to Nurse Lorna Kelly. I'd be curious if you could tell us a bit about what it's been like to be the first full-time infusion nurse at the hospital, and what are you noticing about the challenges for your patients, and how has it made a difference in their lives? I think you're still muted, Nurse Kelly.
All right.
There you go.
Okay. Hi, guys. Again, my name is Nurse Kelly. I have been working at KHMH for over 20 years. Being the first oncology nurse is exciting, very challenging at times because it's new material. But as the process continues, it's getting a bit more comfortable. But my patients, I can say they're darlings. They're up for a lot of challenge. And even on their worst days, they try to be excellent patients, you know. Infusion with chemotherapy is brand new in Belize. We kind of, back when, years ago, we had patients exposing from, coming from Merida, having chemotherapy, having some kind of complication, coming to the hospital, and between the doctors and the nurses, we were unfamiliar with the grounds of complications from chemotherapy and the management. Since I've learned so much about the medications, it's kind of connecting the dots to what I have experienced before, what exactly certain complications would look like and what management I should be able to offer to the patient to make the patient more comfortable. So it's been a little challenging but exciting task.
Great, thank you. And Nurse Bernard, what has it been like for you to serve as the hospital's first patient navigator these past 6 months and year in the program?
Good evening again. I'm Nurse Bernard. I've been working here for the past 20 years as a nursing assistant. For working here at the oncology clinic, as Nurse Kelly stated, it's new to us, right? It's a challenge. And at times I find it emotionally stressful sometimes when the patient comes in with all your different complaints, you know. You try to work with them, you try to guide them through the healthcare, you know, through the hospital setting. You know, I believe that working with the patients, you know, it's that I've been so close to them, and, you know, it's like I'm a bridge between, you know, them getting their treatments, getting their workup done, you know, to follow up the care, and bridge between them and the doctor, because sometimes when they come, they know they don't understand. I mean, coping with cancer is it's something big, you know, it's nothing that they plan for in their life. So it's stressful, it's an additional stress for them. And when it comes to, you know, their children, their finance, you know, you help them to overcome these barriers and see how best you can help them. I always help them to schedule appointments, you know, their diagnostic treatments, you know, when they're scheduled to do their CTs and the machine is not working, I keep check with them at the where they do it at the radiology center, where they do the CTs, then I report back to the patient. So it is an ongoing relationship with the patient and myself, and we work together as a team, you know. At the end of the day, we usually discuss, you know, what happened, you know, how we could do this better, how we could best improve. So I believe that, you know, we form a bond with them, and it's not just treating the cancer, but treating the patient themselves, you know. So it's, you know, like it's a forever relationship with them, because when they finish their treatment and they go for surgery, we follow up on them, we check on them after surgery, we follow up on them, you know, what next, what's the next step through this journey for them. So I always encourage them, you know, to embrace life beyond cancer and beyond cancer treatment. So it's a pleasure to work with, to be here as patient navigator. You know, we're the first, you know, and we look forward to helping the patients as best as we can together as a team, you know, to do our best. Thank you.
Thank you, Nurse Bernard and Nurse Kelly. Thank you both for all that you are doing and have done for your patients in Belize. Maybe I could turn to Kristen and talk more a little bit about your experience as a Go nurse educator and what it's been like in this process to train and mentor this first generation of oncology clinicians and nurses in Belize.
Yeah, thanks, Franklin. Certainly it's been different, right? You know, really recognizing the resources that they have there in Belize versus what we have. You know, we definitely take a lot for granted here in our healthcare. You know, little things like patients have to buy their own chemotherapy, and they have to bring that in with them for their appointments, and then it gets mixed before they get it. Lab work, I mean, we have patients who come in and get their labs that same day, and we get those results the same day, and we really need those results, right, so that we can continue to treat these patients and their cancer without side effects. But the patients in Belize are getting their labs drawn, maybe a week prior to getting their chemo, and going, outside the hospital sometimes to get those things done. As a nurse educator, my biggest kind of beliefs are really to not only educate the nurses, but to really empower the nurses. There's obviously so much that we would love to just teach every nurse, and that's where some of the challenges come in. What are the important things that we have to make sure that we're getting, that these patients are receiving safety, or safe, proper chemotherapy handling. So there's from what is cancer, what is breast cancer, what is prostate cancer, and working with the regimens that we know that that they can give these chemotherapies to these patients. So it's been very specific, yet kind of all over the place as well, right? Because there's just so many things that we want to teach everybody, and obviously COVID has kind of put a damper on that, right? Where we do meet with the nurses twice a month, and we do different training sessions with them and educational sessions with them. But if someone were to ask me, well, what do you do? And that's a loaded question, right? I mean, we do so much that we can't really put into words. But it's just been such a pleasure working with everybody there. There's a phrase, there's a common phrase in nursing, right? That nurses eat their young, right? Which means if you're a seasoned nurse and you're training nurses as they come in, then they usually end up being as brutal as they can to kind of get those other nurses, seasoned, if you will. And that's always been one of my big things, that I will not do that. I think it's just so important to educate nurses who are eventually going to be taking our place, right? And and precepting them and giving them that power, so that they in turn, when it's their turn to do the same, have all of that knowledge and all of that experience to then spread down to the next, to the next nurse or the next generation of nurses. And these wonderful ladies are going to be the responsible ones to do that as the unit gets bigger, and more there's more needs. So it's been wonderful. It's been absolutely rewarding on my end.
Great, thank you, Kristen. Maybe I could turn to Sirkeen and ask Sirkeen if she could tell us a bit about GO's flagship patient navigation program that we've named Directly Observed Care, or GO-Doc. You've played a pretty big role in helping design and implement it along with the Belize team and Phil and others. And if you could talk a little bit about what that's been like, and how how you feel that may help improve and advance care for cancer patients at the hospital.
Definitely. So I've had the privilege of working closely with the KHMH team sort of over the course of 2 site visits, and that has since continued. Big props to Margaret, who kind of took the ideas and have run with them and really been the one implementing them on the ground. But it was really focused on this barrier removal and assessment sort of capacity of the doc officer to help make the patient or the cancer their cancer care and their experience a little bit more.
So maybe I'll just turn it to anybody on the panel in terms of what have been sort of the most fulfilling or inspiring experiences you've had so far launching this unit. I'll turn to any of the nurses or Ramon to answer that question.
I think the most fulfilling part is that we're making a difference. We're making a difference in people's lives. I mean, more than seeing a patient, we see the person, their background, their social background, the challenges that they go, and we see how much our patients are fighters. I mean, they're trying to overcome not only the medical or the disease part, but they're also fighting to get that money to try and get their medications, to try and get their labs done, to try and fundraise sometimes. It it's 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 rewarding to see that, and that we're taking that and changing their lives. I mean, most of the patients, a lot of our patients are patients with breast cancer. A great portion of them are young patients. I mean, and seeing those patients, seeing that they're mothers, that they're daughters, and that we're actually changing their lives, I think that's the most rewarding part. And for those patients who may not be, may not have a curable disease, we're giving them that comfort, that care that they need. They're not alone. I mean, we're not letting our patients alone. And I think the beauty of the program also, and especially mentioning the DOC program, is that we're not letting our patients fall through the cracks. We're following our patients. And if some of them may miss an appointment, we're there the other day calling them. And we're seeing results. I mean, for me, that's the most rewarding part. Changing their lives and overcoming the challenges together. Because even in the fundraising part, if they need it, we get into it too to try and see how we could help the patient. So it's being with them during the course of their journey. And I'll let Nurse Bernard and Nurse Kelly share their experiences at the ward.
Yeah. Hi. I can tell you that my fulfillment of being an infusion nurse is to know that Belizeans don't have to leave their extended family to go miles away, spending weeks in another country, battling with finance, you know, because when you leave, let's say you leave Belize to go to Merida for chemotherapy back when, and you would have to make sure that you have, first of all, over $6,000 to just leave the country. If you have a low income house, $6,000 may not seem a lot to you guys, but that's a lot of money for somebody to come up with in a short space of time. By the time the doctor would say, oh, your diagnosis is this is what you need to do, and this is the time span you have to do it. Just the news alone shocks these patients. So before you can come out of that shock phase, you have to be thinking about, how can I get this money? What can we sell? How can we fundraise? How fast can we move? I mean, family members thinking, oh, my relative is dying now, you know? But when you come to KHMH and you listen to the patients feeling so at ease, you know what, nurse? I'm happy that I could catch a ride and go back home to my family tonight. We don't have to pay for a hotel. We don't have to worry what we're going to eat for the week or the 2 weeks we have to be far away from our family. You know, yes, we have to find the money for our treatment and to pay for the services, but it's less. And we know that we have an interval of 3 weeks. So we have 3 different dinner sales we can do in order to raise for the next chemotherapy, drug, and treatment. You know, so that's a burden kind of half lifted, I want to say, on my patients when they talk to you about things like that. You know, yes, I may, my diagnosis may be palliative, but at the same time, I get to go home. I get to see my daughter. She's only 2 years old. I get to see her, to hear somebody feel the joy of, yes, my life is ending, but I get that little time that is left with my child is so fulfilling that you can be a part of that.
Yeah, I would just like to add, I usually tell my patients, well, tell the patients when they come, you know, whenever they come from the time of consultation, whenever they become a patient of Dr. Yacab, the specialist, they become a patient of mine also. I follow them up from the time of diagnosis throughout the cancer, the whole cancer journey and beyond. And when this patient comes, they're afraid, they cry, and sometimes I have to be strong not to for them to see me cry also or to feel so overwhelmed with, you know, their diagnosis. So I encourage them, you know, I say we can do this, we will try, we will not, okay, diagnosis cancer, yes, you have cancer, but we will fight it, because when the cancer, when those cells, they start to fight, we have to fight back. We can't just give up. So when they come for their treatment, you welcome them, you know, you make them feel at home, you know, this place is so welcoming and nice. And to see, well, I thank these guys very much that they, you know, they got us off the ground, and now we're doing this, because I could never imagine that we would have, KHMH would have an oncology unit here in, you know, right here in Belize City. So when these patients come, you know, you welcome them, you do what you have to do, you do their vitals, you educate them, you know, they do their pre-assessment, you educate them, you make them comfortable in those recliners, you know, you talk to them, you educate them, and so that they could know what they will experience after chemo when they go home. And whenever they go home, I would call them. Sometimes I would say, okay, I would call them 2 days or 3 days after. But I remember one patient told me, said, nurse, he said, the same night, that patient started with nausea, with vomiting, you know, and then, you know, they know what to do, you know. I always tell them, you know, this is what you should do. If you're having vomiting and diarrhea, and you're taking your medication and it's not working, you know, you come to the hospital immediately. So these patients, you're so involved with them that, you know, when you give them a call, they're so grateful. They say, thank you, nurse, because I didn't think that you would continue to check on me, you know. They're very grateful. So, you know, it's been a blessing for us, and we will continue to do our best to support them in whatever way, to follow them through this whole ordeal with their cancer.
To know that Global Oncology has educated us nurses and gave us materials for backup. We find that some of the patients that have been exposed to the Merida system, they come in the chair and you introduce yourself and you tell them what kind of medication they're getting, and you tell them the possible side effects that they need to look out for, to find out that these patients never knew what drug they used to get. Nurse, we sit in the chair and then just give we the medication. We don't know what we to get. We just know we to get chemotherapy, but we don't know what it is. So you go into a strange country, you may not be bilingual. So even if they're trying to talk to you, you may not understand what they're saying, but at the same time, they don't tell you what they're doing. So that patient is kind of in a fear, shock moment. But when you come here to KHMH, now the language barrier is limited because we all speak the same language. So they can talk to us and we can talk back. We inform them about what we're doing each step of the way, so they feel more comfortable knowing that, yes, I did in my own country. Yes, I could understand them and they could understand me. And even talk to them, speak to them, explain everything. They would come to the nurse and say, nurse, what that mean? Because it's a cultural thing that it's not all the time you ask the doctors all the questions. You wait till the nurse, you get to the nurse, and then you say, nurse, I never understand what this may mean and what that may mean. And then we're there to explain and educate, you know, and we give them materials to go home with, and you check back. You don't have that when you leave your country. You really don't. You have good family support, some of them not so much family support, but by the time Nurse Bernard calls them, that's their family. And then you keep checking up on them and they feel love. Yes, I'm dying of cancer. Yes, I have cancer, but there is somebody that is concerned about what's happening to me. I may not have a daughter, I may not have a husband, you know, but the nurse calls and she checks. Even when I think she won't call, she calls, you know, and that's showing love to the patient, something that some of them don't even have.
Well, thank you, both of you. Those are very moving words about the care that you're providing to those patients there. I think what we'll do now is we'll move to sort of question and answer from our participants here that are on the salon. And I'll turn it over to Phil, and hopefully we can hear from other panelists during this session, and turn over to Phil, who will ask people to unmute themselves or show their video to ask their questions, or read questions from submitted questions.
Great, thanks, Franklin. So once again, I'm Phil Garrity. I'm the program director with Global Oncology. I've had the great pleasure and honor to work with the folks on the panelists and travel down to Belize to help support the launching of this new public oncology unit over the past 2 years. So, so as Franklin said, we're gonna do some questions from the audience. We're sort of running tight on time. We want to end at the hour. So we did get a few written questions, so maybe I'll start with one of those. And then if anyone wants to, speak their question directly to any of the panelists, if you know how to, you can raise your hand in Zoom. And if not, we'll try to keep an eye out for you if you want to wave your physical hand or unmute yourself. I'm sure we'll figure it out. So just an initial question from Perrin, and this is super helpful just to kind of set the context. He asked, approximately how many new cancer patients does the National Hospital see every year? And what's the size of the oncology team to provide service to those patients? So Dr. Yacab, could you speak to some of those numbers, maybe give people a sense of the scale?
In the consultation and the infusion, it varies on each day. We would see sometimes 7 because of COVID, we're confined to a certain number, and the infusion, because of the small space, we only have 5 recliners and we need to social distancing. We would have like 3 people in the unit at any one time, but it's from 1 to 3, the maximum at any one time.
Gotcha. Great. And Dr. Yacab, I was just asking if you could give a sense of maybe some of the numbers, like how many patients you're seeing each month, or might be a good way. And then also, yeah, in consultation or infusion. And you're muted right now, Ramon.
Consultations, what we've been seeing, it's been roughly around 150 to 200 consultations per month. And in terms of infusions, it may be roughly around 40 to, I'd say, around 50 infusions per month. I mean, looking back from where we started once every so often to doing it now on a daily basis almost, I mean, numbers are increasing. And the thing is that every day we have new patients. I mean, we are becoming the referral center here at Belize now. So every day we have new patients. In a general month, we'd have around 40 cases of new cancer cases.
Right. And Ramon, also, could you give a sense too of like what proportion of the total cases in the country would you say that you're seeing at this point? Just if you had to guess.
I'd say probably, around, because borders are closed, I probably say around 80 to 90% now. That's what we're seeing. And from there on, we refer the patients. We become like the central area. And from there, we decide the management for the patient. If we have to refer for radiation services, if we have to keep the patient for chemo, if we have to refer, well, at the different services, and if the patient has an advanced cancer, if palliative care is only required, then we refer them to. So we're becoming that central part within the country when it comes to cancer care, because the services that are being offered are very comprehensive, meaning that if a patient comes with a stage 2 breast cancer, we get the surgeon on board on the same day to evaluate the patient if the patient is fit for surgery or not. If not, we discuss with the patient chemo and we start promptly. And we try and streamline the patient in such a way that there's no delays. If the patient starts treatment with chemo, we try and keep on track to avoid delays. If the patient needs surgery, we're on top, we're behind the surgeon to get that patient ready for surgery. So it's kind of like that on a regular day.
That's great. Yeah, thank you so much. And that's really impressive. You know, for folks who don't know, Belize is a pretty bite-sized country, 400,000 people, which is about the population of the city I live in Oakland, California. But, you know, has all sorts of challenges with just being incredibly diverse, you know, culturally, linguistically. People are spread, you know, in all different sort of geographic regions of that country. And also it's very porous with the neighboring countries of Mexico, Guatemala, you know, and a lot of the movement between there. So a lot of unique challenges there, but pretty amazing to see that a vast majority of, you know, new cases, new cancer cases are coming through this particular public oncology program that Dr. Ramon and his team is leading. So it looks like Perrin, you're raising your hand. Do you want to unmute yourself and ask a question?
Sure. I feel like maybe I'm hogging the time, but
no, go for it.
one you know, given the bias because I worked for Varian, I'm trying to understand the onus on patients to travel for radiotherapy if you refer radiotherapy. What are the sort of barriers to providing that sort of service for you right now?
I mean, right now, in terms of radiation therapy, I think the major barrier is the finances. Why? If radiation is needed, we've managed to make contact with one of the semi-public radiation centers in neighboring Mexico, either at Campeche or either at Merida. So we managed to refer the patients. And even though the cost is less, it's still a couple of $1,000s. So most patients, what they're doing is they're trying to fundraise in order for them to go abroad. So I think the major constraint is finances. Right now with the COVID contingency going on, even coming out of the country, we need special permissions. So I think that may be a limitation that patients may face, but that's, well, we generally work around that. We generally get those permissions for the patients so that they could travel if needed. But I think the challenge is the financial part, getting that money for the service.
Yeah. Thank you, Ramon, and thanks, Perrin, for that question. So because we're running short on time, I know there's probably a lot of, you know, great thoughts and questions. And, you know, we hope that this is really just a starter, that people will be interested in reaching out to us and getting involved and learning more. But just for the sake of time, I want to actually pivot now to, in our, you know, final few minutes here, have two of our directors, Amy Judd and Donna Remen, say a little bit about you know, why they're motivated to be involved in this work and ways to get involved and support the work. So I'll hand it over to them. We'll pull you up on the spotlight here. And thank you so much to our panelists. We are so much more enriched because of your contributions in this hour and just the work you've been doing generally. So thank you. So Donna and Amy, go ahead and unmute yourselves and we'll get you spotlit here.
Thank you, Phil. Thank you so much, everyone, for such a inspiring, moving update. You're making incredible progress. It's very exciting and, whoops, okay. Just wonderful to hear how much progress you've made, and hopefully it will inspire other regions in Latin America and beyond to provide in-country services where none currently exist. You know, there's no surprise that this program is going well, given the very capable leadership at Global Oncology and tremendous effort and dedication on the part of those on the ground in Belize. I want to congratulate all of you. I first met Ami and Franklin about 8 years ago while they were clinical fellows at Harvard. I was then working at the Brigham in the Division of Global Health Equity. I also worked with Partners in Health on some of their projects. And from the outset, I was tremendously inspired by their passion for trying to address disparities in access to cancer care. I've always been impressed by their superhuman work effort and stellar expertise, as well as their very compassionate, generous manner. It's been a privilege to work with them and all of the staff at Global Oncology. As someone who's been living with advanced cancer for now over 10 years, remarkably, I know just how crucial it is to have high quality care available and access to resources to stay alive, quite frankly. I'm so very grateful for the amazing care I receive here in Boston. And I'm also very aware that this type of care isn't available to everyone around the world. In fact, to many people around the world. And so I think about, the grateful patient charitable donation concept is one in which those of us who are privileged enough to have access to high quality care should try and make that possible for other people who don't. I'm privileged to be able to help GO pursue its mission and achieve accomplishments such as we've just heard about tonight. And I want to encourage you to join me by contributing what you are able to help support this work. Thank you. And Donna, can you get into some of the more detailed information around donations, please?
Absolutely. Thank you for the handoff, Amy, and thanks to everyone for being here. And sorry for taking your time above the hour. I'll try to be brief, but it's going to be worth the wait. Global Oncology and all who come with it have been a huge inspiration and source of learning for me for the past 6 years. I'm humbled to have been on staff for almost 5 of those years and now to be serving as a director. The accounts we've heard today are truly hard to fathom. I personally had the privilege of traveling with Franklin and Phil to Belize and working with this incredible dedicated team. I had the unique chance to observe Franklin and Dr. Yacab kindly caring for patients who had so very little and were so confused and distressed. Every cancer patient everywhere deserves at least this much, a chance to be treated appropriately and compassionately for their disease. Yet there's a huge dichotomy between what cancer care is in the United States and what it is in many other countries. We need to bridge the gap, and with your help, we can show the world how feasible it is to prevent, treat, and palliate cancer with high quality interventions. We invite you to step into this challenge with us. Having seen tonight what can be done on a shoestring budget and against the odds, it's incredible to think what more we can still accomplish together. Let's do this. Let's empower Dr. Yacab and his team to do their best work, and let's serve as a model for other settings in need of establishing centralized cancer care. Due to the pandemic, GO is unable to host our regular in-person fundraiser this year, which normally accounts for most of our annual revenue. As such, we're hosting this wonderful virtual Salon series, both to educate our supporters, new and old, as well as raise funds necessary to continue our impactful work. Some of you have already given generously to help us reach our year-end goal, and thank you deeply for that. It takes all sizes, and every single gift matters. We're asking each of you to consider making a gift this evening, enabling Global Oncology to take the great work it's already done in Belize to the next level. To give you a sense of what GO and Dr. Yacab's team can do with your gift, finish building the mobile data collection platform that will allow patient navigators like Nurse Bernard to track cancer patients in real time with handheld devices, develop a training curriculum that will allow the first generation, of oncology nurses in Belize, including Nurse Kelly, to onboard and train the next generation of nurses, and create a toolkit that allows us to adapt GO's directly observed care model to other emerging oncology programs in low and middle income countries. There are a number of easy ways that you can support these efforts. One, donate online, globalonc.org/donate. We've pasted the URL into the Zoom chat. Two, make a pledge by completing an online pledge form. Also, the URL is in the Zoom chat. And three, participate in the No Boundaries campaign, an online peer-to-peer fundraising campaign that invites people to share how they've been impacted by cancer and why they believe everyone deserves access to quality care. If you've been impacted by cancer in some way through your own health, through that of a loved one, or an article you read, or your work, we invite you to create a page, tell your story, and share it with your community. Some of our very own Go volunteers, Kristen and Sirkeen, have done so, and we invite you to visit their campaigns and help them reach their goals. And the URL is also pasted in the Zoom chat. Another wonderful reason to make a donation tonight, an anonymous sponsor has generously offered a $10,000 matching gift. Thank you to the donor. That means that your donation can go twice as far in allowing GO to continue its work to support Belizean cancer patients throughout their care journey. And last, but certainly not least, another way to support GO is to get involved with volunteer opportunities, both in the programs you heard about today and in leadership capacities, such as on the board or a subcommittee, which benefit from expertise in every field. Please reach out to Franklin, Amir, or Phil for more about those roles, and we can put those email addresses in the chat. And in closing, thank you so much for joining the Salon tonight. And please know you can elevate this organization to the next level of impact. It's you who can do that. So take great care of yourselves tonight, and take great care of yourselves, and good night.
Thank you, Amy and Donna. And just to close, this has been a really phenomenal hour. And want to thank our panelists, Dr. Yacab, Nurse Kelly, Nurse Bernard, Sirkeen, and Kristen for joining us. We really am fortunate to have your participation and great work with us. We've heard a bit about the amazing progress of the Go-Belize partnership. And we hope that we will continue to do this work with your support and with this community that we've built together. So a lot more work remains to be done. And as you can see, we've made great strides, and we continue to do this work to really do what is best for our patients and these patients in Belize. And can't say enough about how privileged we are to be in this work together with our partners in Belize. We just have one more announcement that we'll be holding another Go Virtual Salon next month that will be focusing on our cervical cancer campaign in Nigeria. And also, if you're interested in learning more about our programs, again, feel free to email info@globalonc.org or visit our website or reach out to any of us that have been on the call today. We'd be delighted to talk to you. So we hope you're taking good care of yourselves and each other. Stay safe, and we thank you for joining us this evening and afternoon. And thanks to Phil and Michelle Sahai for helping organize this salon, and we will look forward to seeing you at the next event. Thank you.